that I think is so important for us to think expansively. Bring our key stakeholders to the table. Do this in partnership. Policymakers, politicians, hospital systems, community health centers. How do we do this together? It doesn't matter which door people go through, as long as they get the care they need.
Today's conversation is about legacy, what it takes to build something that lasts, and what it means to carry it forward. This year, Lifelong Medical Care in California is celebrating 50 years of serving its community. And my guest, John Jenkins, is leading the organization at a uniquely personal moment. His father, Dr. William Jenkins, helped shape care in the very communities Lifelong serves. And before stepping into the CEO role, John served as board president, giving him a rare perspective on both governance and leadership. In this episode, we talk about what 50 years of community health really teaches you, what's changed, what hasn't, and what it takes to sustain this work for the future. I'm so excited for this conversation, so let's dig in. Well, good morning, John. It's good to see you. Can you just get started telling us about yourself, sort of introduce yourself and your background and how you got involved in health centers?
Sure, for sure. Good morning, Amanda. Great to be here. Thanks for having me. I'm John Jenkins. I'm CEO of Lifelong Medical Care, an FQHC based in the San Francisco Bay Area, specifically in the East Bay, serving across Berkeley, Oakland, Richmond, and the greater East Bay. We've been in operations for 50 years, and we're celebrating that 50-year mark today as we speak. I got involved with community health through my family. I'm fortunate to be the third generation community health practitioner. Although I am not a provider, my father and grandfather were, and specifically got involved with community health in our area, really because of helping to transition my father's practice. He practiced for 50 years within the Lifelong footprint, was a private practitioner, came west as part of the Great Migration to serve underserved communities who otherwise weren't being served. Throughout his career, he saw over 1 million patients. And when he was 82 years old, he still had 5,000 patients in his panel. And for, a decade before that, there was a lot of discussion to say, hey, Dad, someday you're not going to be able to practice, and those kids are going to need care. So what are we doing? Long story short, we got to the point where he said, hey, he's no longer going to be able to work. I ran the practice for a period of time and ultimately merged it with Lifelong after a search for some great partners. And it joined the board and been a part of it ever since.
That's amazing. I remember when you first shared that about just sort of your dad and, how the original connection to the health center. And it was like, first of all, I was floored, but also in a way, it is so foundationally the health center story to sort of, and I want to take a minute to lean in a little bit more and to hear more about your father's career and legacy. And, really, I think in particular, how he shaped care in the community. And I'd love for you to speak to what do you remember most, sort of what really stands out in terms of his practice and the way that he cared for the community?
I said there's three things that I think about when I think about his practice and him taking care of the community: mission, commitment, and responsibility. He had a mission. He was drawn to this. It was a calling. He had felt just clear responsibility to provide care for this community, and ultimately a commitment to show up every single day. And when I say every single day, I mean every single day. His clinic was open 6 days a week. He was doing rounds on Sundays. He saw anywhere between 80 to 120 patients a day. And he stayed in the office until the last patients were there. What does that all mean for me is that was a trust between him and the community. They knew that he would be there to provide care. And not just care, the highest possible quality care. And as a result, there is that relationship between him and the community. They knew they could count on him every single day to be there to give them what they need. And so that was my perspective of seeing this is what it takes and this is what the requirement is. At the same time, how does it feel for me? How did it feel for me as a kid? I think the best example was Pride, walking through the mall in Richmond, going to the movies, all these patients coming up to him and say, hey, Dr. Jenkins, great to see you. Thanks so much. Every once in a while I said, hey, my kid's got a sniffle. And then he'd say, well, come into the office tomorrow, we'll be okay. Yeah. But it's that type of relationship and caring I think it really is tangible in terms of what it means for the type of work we do.
He really sounds exceptional. And I mean, I can't even imagine. It doesn't surprise me to hear that he practiced into his 80s, just hearing you speak about his story. And at the same time, I'm just like, my gosh, just I can imagine, like you said, the commitment and the dedication to the community and just feeling like I can't possibly not, like that there's so much need. I want to take us off questions or off sort of planned questions for a second to ask you, because he clearly practiced for so long. One of the things that has been really interesting for me in the last couple of years, especially, is that it sort of feels like in primary care, everything old is new again, where it's like, whether it's home visits or it's, prescribing groceries and nutritious. I mean, it's like, there's just certain things where I'm like, yeah, this has actually been a thing for decades. And so I'm curious where your dad, obviously was serving the community for as long as he was, and the needs of the patients he was seeing. Does that resonate with you? I mean, did you see sort of the transition, and even maybe when your dad was practicing in the early days, and then where things are in terms of lifelong today? I'm just curious if you have any reflection on that.
Absolutely. Patients are patients, families are families. They need care. They need great care. That doesn't change. The good news is over the past 40 years, healthcare has improved.
Yeah.
People's health has improved. That's great. Between integrated care, value-based care models, immunization, EHR, people's health has improved. It's become more complex. And if anything, that's part of the transformation that's happened in healthcare over the past 40 years. And at hospital systems and private payers, that complexity has definitely taken place. I think if we look across the community health center landscape, there's different advancements along that transformation curve. And in terms of, where we are and what we need to do, I think it depends on how far we've come down that path. At the same time, it's taking care of patients, taking care of the community. That doesn't change, regardless of the complexity, regardless of the changes. And that connection between provider and patient, clinic and the community, that's critical for what we do. And so regardless of, how things have changed on the outside, it doesn't change between the patient and the provider. That's for sure.
No, I couldn't agree with you more. And I think that's also one of the things that differentiates health centers in a way from a lot of other providers, where you have folks that are so invested and embedded within the community, and much like your dad, served and cared for patients over generations, where they have seen multiple generations of families and the trust that is involved in that. It's a really important part of, I think, the health center reality and the health center model. And it just sounds like that was very much the case with your dad, which makes sense. And thank goodness you guys did end up kind of choosing the path to merge with Lifelong. I'd love to hear about, obviously, we just spent some time talking about this incredible family history that you have with your dad and the community. But at what point and sort of how did you make the decision to kind of step into this space and have community health and work with Lifelong become a part of your path?
I'll say there's no one linear, clear answer. That's for sure. I actually do want to zoom out for a second, though. And, while my dad gets a ton of credit, clearly a huge impact on my life, I was fortunate to be raised by this incredible broad group of family by choice. These other physicians who came to the Bay Area as part of the Great Migration. I could spend an hour going through the names of each of them and the impact they had on me as a young person. But at the end of the day, it's all of them, their commitment, their feeling of responsibility, their desire to make good on this mission of just taking care of the patients, taking care of the community, of people who otherwise wouldn't get care. My father was the first African-American resident at Children's Hospital in Oakland in 1960, but he was just the first. Dr. Mike Lenore, who was a family friend growing up, a great role model for me, and now I have the privilege to work with now at Lifelong. He recently told me that in the 1970s, 1980s, there were 135 Black physicians in Oakland. I just took that for granted. Those were my role models.
Yeah.
And where am I going with all this? The point is that like this was part of the family upbringing for me. And so this was part of the responsibility. Now, I didn't go down that path professionally, but it was always part of what I felt an obligation to take care of. And long story short, in my 30s and when my dad was in his 70s, we had that conversation. Say, hey, Dad, you can't do this forever. How are we going to do this? And ultimately, I helped plan and push, and we came to that terms when he could no longer work. I ran the practice for a period of time, hired in physicians, worked with the staff, made sure our patients knew we had a stable, trusted clinic still, while we looked for a new partner. And that's when I got in touch with Marty Lynch, who was a longtime CEO of Lifelong. And it made sense because of shared values, shared mission. This is a great place. Lifelong is a great place to continue to provide great care to our patients. And we decided to merge with Lifelong. And we agreed for me to join the board of directors at the time. And I remember one question I got from Marty during that time, which was, this just isn't about your dad's practice. And I said, it's never been just about my dad's practice. It's about providing high quality care to this community. So absolutely, I feel a need to be part of Lifelong moving forward. And then for the next 13 years, I was honored to serve on the board of directors. And then last summer, when I was asked to step in as CEO, there was no question. It was just yes, this is what needs to happen. And so I put my professional life off to the side and just stepped in and did what we needed to do. And if anything, it goes back to what I said, those dozens of role models I had as a kid who said, yeah, it's about mission, responsibility, and commitment. And so here I am.
There's so many things about that I want to dive deeper into, but I think one of the pieces, John, that I would pull out is that I think the importance of modeling, and I think in so many different ways, sort of professionally, and just, obviously you came from a family, not just your dad, but it sounds like a family of providers. But I think the bigger commitment to mission and sort of modeling the fact that that's the commitment, that's the reason, that's the why, and the power and the impact of that can have on a young person and sort of what that looks like over the course of time in their own professional path. What a gift. And I'm sure unforeseen. And I'm sure also, every family, of course, has its moments where it's like, okay, there's pros and cons to all these things, but it's pretty incredible to hear that story. And your journey, like I said, just in terms of like, basically, so it sounds like you ran the practice for some period of time, but were really discerning also about who is the partner to work with in terms of what happens next. And so much gratitude. Marty is, a dear, dear leader always in the health center space. And so I'm not surprised to hear that was the conversation with him. But again, I feel super grateful that you guys were paired up and just to see you in the position that you are now, particularly with the history that you have. I'm trying to think of where I want to take this because like I said, I have a million questions for you, but next one I'll offer is just, what does it feel like now to be leading in the same space that your dad helped build?
It's humbling. That's the real thought that comes to mind. I don't use this lightly. I stand on the shoulder of giants. I really do. And it's not just those models that I knew growing up. Everyone else who helped create the community healthcare movement, community health center movement. It's really humbling to be a little part of this overall. Dr. James Jackson was my Uncle Jack, and he came west, was an OBGYN, helped create Arlington Medical Group. I saw that he delivered over 8,000 children in his life, but he knew it was bigger than just about him and his practice. And during his time, he saw the health disparities of the patients within his community that he was serving versus more affluent neighborhoods and communities nearby. And he said, look, I need to take care of this. This is my mission. This is my calling. There's a responsibility here. And he eventually left private practice and moved into public health administration because he saw opportunities and real need to address that at a bigger level. I'm fortunate to be able to know people like that specifically. And I say that just because, for every Uncle Jack out there, there's hundreds, if not thousands of others who've done similar things. And so for me to be able to come in here and just do a little bit to honor that commitment, and not just the commitment of people like him, but also the commitment of our MAs, of our team, who are members of our community, but at the same time, they're here. They have choices on where they can work. They come in every single day, and to respect that commitment and giving of their lives to come here and serve their community, it's humbling, to say the least.
Yeah, I'm really glad and grateful to hear you say that. And I couldn't agree more. I mean, I think to your point, whether you are helping with security, answering phones, you're in the clinical space, you're a community health worker, you're in senior administration, or everything in between, we all have a choice, and everyone is choosing to work at a health center. There are many, many other jobs that could be done. And I happen to believe and have witnessed over and over again in the time I've been doing the work, that it's a choice. People are drawn to it and they stay. That's the other thing. I think the tenure in the health center space is unlike anything I've seen. I will say to your comment about, standing on the shoulders of giants, me too, number one. And feel so privileged over the course of the 20 years that I've been involved to have met so many of the folks who began, who were putting paint on the walls, at the very beginning of the time of their health centers. And like you guys, not so many that are hitting their 50th anniversary, as I know you guys are this year, but, for decades. And just truly the blood, sweat, and tears that went into establishing the organizations and continuing to provide the care, developing the model, proving over and over and over again. And back to what you said in the beginning, health has improved. I always think about, with a little bit of almost kind of biting my tongue when I think about the pandemic, because so many of the lessons learned during the pandemic were not new lessons for health centers. It was like, oh, I'm glad everyone's having their light bulb moment about health disparities and, the importance of trust in the community and all of the different things that health centers have been doing for 6 decades. But man, I mean, it's been amazing to see some of those founders and so many of those leaders have an opportunity to catch their breath and sort of take a step back. And also, it's so bittersweet every time I see it, because it's like, I can't imagine doing this work without them day to day, sort of continuing on. I imagine it was much the same with your dad. But yeah, it's, when we talk about legacy, I mean, apropos too, given that it's, we're just past the 60th anniversary for health centers as a program. But yeah, there's so many people that have enabled us to see the success and the impact that we have. And it's pretty incredible.
Amanda, on that point, it's meeting that commitment. It's showing up with respect for our patients, to our teams, and doing the work necessary to make sure we're here for the next 60 years. That's how I say we meet that commitment and recognize, look, the world's changing. It's changed a lot in the past 6 years, that's for sure, which is good. We maybe don't like all the changes. At the same time, I think the best way to respect that work, respect their work, is to do the work to make sure we're here for the next 6 years. Look, we provide a critical part of the U.S. healthcare system. Yeah. We're doing work that other people can't, or unable to, or are unwilling to do. It's okay. We do it really, really well. We take pride in that. If anything, that's the work that we need to do, particularly as administrators, is to figure it out. What do we need to do in terms of the model? What do we need to do in terms of the funding? What do we need to do in terms of staffing? To make sure that we can respect the work that's come before us. That's for me, that's the fun work. It's hard. And I think in many ways forces us to think differently with respect to where we've come from, but also acknowledge that we're going someplace that might be a little bit different than from exactly where we came.
Yeah, I'm smiling because one of our first conversations, John, I think we talked about exactly this, that, even in this environment where it's not without its challenges, and we are in seriously a moment of change and I think in transformation, and that can be difficult. But at the same time, I totally agree with you, and one of the things that I'm most proud of when it comes to ACH and grateful for is exactly what you're talking about, is that it's about building on this incredible foundation that's been established over 6 decades, but looking forward and thinking outside the box, all of it core to mission and patience. It's sort of all of that, the guiding principle is, okay, what can we do in terms of staffing? What are we doing in terms of value-based contracting? What are we doing in terms of technology? How are we evolving an integrated care model? All of the things I know you guys are looking at and driving at every single day. And again, I'm proud of ACH for being able to bring that to Congress, to bring that to agency administration, and this beautiful patchwork that is propelling us forward. It's not going to be, and it hasn't been without its bumps and bruises, but I totally agree with you. I'm excited about where we can go in the future. And I have absolutely no doubt that health centers will be even stronger and an even better and evolved model in the next 60 years. So, that's a whole other conversation of what's it going to look like in 60 years, which I'd also love to have. But that's something I come back to. I think, as I said, it's a moment in time that's turbulent and challenging for health centers, but I think even more so for many of our patients. And it's easy to get kind of mired in that and at times even feel a little paralyzed by it. But what I always come back to is sort of, one, the commitment to do more and to do better and to get excited about what can be. And sort of, I've been fortunate. I had one boss in particular who encouraged me relentlessly to sort of stop thinking inside the sort of blinders of what is and start thinking outside of that to what can be and then drive at that. And I see you guys doing that every day. I see that with Lifelong, which brings me to my next question, because you guys hit 50 this year. So what's that like? And tell me about, obviously we've heard about the trajectory with your dad and, obviously your time on the board and sort of where things are now, but that's a big milestone. I'd love to hear more about it.
The fact that our patients and our communities have given us their trust for 50 years, to be honest, the fact that we're here. And I say it like that, not out of surprise, but just recognition. 50 years ago, Lifelong was created by a group of advocates who wanted to make sure that patients got the health care they deserved. That healthcare is a human right and everybody deserves it, regardless of their circumstance. Here we are 50 years later, serving over 50,000 patients across 15 sites, over 1,100 employees. By the way, those employees, they're members of our community. Yeah. They rely on us for their livelihood. As a result, we're part of the community as well, right? We're part of that foundational element of the community that they can count on us for care. And not just that. I mean, look, the example I gave before about my dad at the mall, seeing his patients there and the pride I got there. I actually know that thousands of people have that same opportunity right now as well. Going with their parents who work at one of our health centers and seeing the people that their parents help at the store, at church, walking down the street, that's what this is about in many ways. And so you ask me, what does 50 feel like? It feels like a permanence that we need to continue. It creates an urgency to make sure that we continue to do this great work. Here's the other part I want to get out there. The work of taking care of our patients is hard. It is hard work. For those of us who are on the front line, we need to make that work as easy as possible. We need to find ways to make sure that the organization is stable, that they don't have to worry about funding. They can just take care of their patients. That they don't have to worry about their own health care, their own benefits. That's the work we have to do, and we will. And for me, that comes back to we need to be here for the next 50 or 60 years. Absolutely. And let's do the work to make sure we will be. The advocacy work with ACH, the work of expanding access, running our operations internally, and everything in between. That's what 50 feels like. If anything, it's midlife. We got to make sure we continue to do the maintenance work to make sure these next 50 years are great years.
Don't get me started on midlife discussion, John. I can relate. But that's a fun way of thinking about health centers. I like that a lot. You said something that I want to lean into a little bit, which is, health centers are 100% of and for the community. And I think that that's very evident in the community, or the consumer majority board, which is completely unique to health centers. And we talk about that a lot with so much pride and appreciation, that the people who are actually consuming the care are the ones helping to design and operate and manage and govern. But I think the other point that you make is really important too. It's not just the board, it's also the staff. It is the whole team, many of whom actually live in the community and are engaging with their community members and their patients day to day, like you said, whether it's at the grocery store, at church. And I think that that's a really important part of the health center model, but also the health center story that sometimes gets overlooked. We also talk a lot about the importance of health centers as economic engines, as employers, all the goods and services that, are coming through health center doors and operations, particularly in rural communities where we know in that case, there are some of the largest employers. But I think whether it's rural or urban, it's a hugely important part of the community in such a vast array of ways, between the care and the access that's provided, but also the way that it is touching the community through the economics, but I think also just the trust that's developed, because it is the person that you're seeing at church. It is the person that is putting food on their table because of the health center employing them and all of the other opportunities that come in that space. And I think, policymakers get it, but I have seen, especially recently, more and more sort of the light bulb moment going off where they're sort of like, oh, okay, that's a little different. That's not something that we're hearing when it comes to a lot of other health systems and providers. And that's not to diminish, but I do think that it's something that really sets health centers apart in an important way. But I'd love for you to speak to also just, I know you well enough at this point to know that, yes, you're the CEO and you're doing all of the important work that entails in terms of making sure that the solvency and the operations of the organization are set and taken care of and propelling forward. But I also know you well enough to know that you're someone who really values time and connection with the community and with patients. And so I'd love for you to speak to, just if you can share a moment that you had with a patient or a family that captures why the work matters and sort of something that really stands out to you.
Yeah, great question. Before I get to that, I want to go back to what you were just talking about in terms of the team being the community. I would say that's my big aha moment, my big learning, transitioning from board to CEO. I was on the board for 13 years, and it really required me to get inside every day to understand that on a practical level, our team is the community, our community is the team. And I mean that. I don't know what the numbers are, but my guess is it's well over 2/3 or 3/4 of our team live in our community. Yeah. It's probably more than that. And I say it on a practical level because, with the composition of the board, 51% needs to be consumers, all makes sense. When you spend time in the clinics, I'm at the clinics 4 times a week. And when you spend time there and you walk through the front door and you see the exchange between the patients and the staff, and you realize that, that exchange didn't begin right when that person walked up to the desk. It happened at the grocery store over the weekend. It happened at church Sunday morning. It happened because somebody said, yeah, you can trust Mrs. Flores to come in and get the care you need. She'll take care of you. That word of mouth referral is so important, particularly for our community where trust is critical. We haven't always gotten the care we need in our community. And to be able to trust the providers who do it, that really breaks down that barrier to get people in. And so, that's my biggest learning as CEO, to really recognize that our team is the community. That's something that we need to recognize and make sure that all key stakeholders know just how important that is. Going back to your question about patients, we had our 50th gala just this past Saturday night, and we had a patient come in and share her story. She's been a lifelong patient for 30 years. To be clear, it's not just her. At least 3 generations of her family have been lifelong patients. And I say at least because the story she shared, it was just her, her children, and her grandchildren. She has 9 children, many of whom were adopted. Most have complex medical cases, significant complex cases. And she's been a patient at the Lenore Clinic for those 30 years with her family. And it's that trust issue. That's the important thing that matters here. She shared the following. One of her children had a condition, had symptoms. She ended up in I think an ER, an urgent care clinic that wasn't a lifelong clinic. And the care team there, with a lot of respect, but they dismissed the concerns, in part because they didn't know her. They didn't know her family. They didn't know her history. Well, she went back in to see Dr. Lenore, and he listened. She trusted him. He said, we'll take care of this. And they did the work to really figure out what the issue was. And it was a complex medical issue that was being dismissed. But if it wasn't for that type of committed, in-depth, intimate type relationship, her child wouldn't have gotten the care that they needed. And with that type of experience, with a lot of pride, she stood up and said, I am a lifelong patient. And I tell everybody about that because of this type of experience I had with lifelong and their ability to take care of me, my family, comprehensively. That was a wonderful story to hear. And to be honest, it's just one of thousands that we could go out and get for sure. But it's just that reminder of why we do the work. What's the motivation behind it? If anything, that provides all the motivation we need to go out there and do the work every day.
Yeah, 100%. I mean, I think we're in this really interesting, a little bit frightening moment, though, where, that is the health center patient story, right? It's being able to rely on access, it's trust, it's, generational investment in terms of the provider to multiple generations of patients. And then I look at what's going on right now, and it is a little scary. Not because health centers won't be there. You will be. I know you'll continue to care for these patients. But I worry about the reality of some of the policies that have gone through, the resources that are there to support health centers, the lack thereof, and the impact that it has on our patients. And just the reality of, okay, I already know that you guys are doing everything to stretch every last dollar to figure it out, to make it work, and you're masterful at it. But I also know that we're in a moment in time where, because of all the change and the transformation that we mentioned, all at once, and then so many different programs sort of under threat or attack all at once. I do worry about that some, just in terms of, can health centers endure? Yes. Will they? Yes. But some of the losses in the midst of that, and sort of what that is going to look like, which brings me to another question for you, which is, now as CEO, what feels most urgent? What's keeping you up at night? What are the worries, just in terms of, some of these things that we're facing in the environment right now?
You named a couple of things in there. Urgency, fear, sustainability you didn't say it, but that's what I'm really taking away from it. Making sure we have impact, recognizing that resources are scarce. That's the work. I've said that a couple times, right? The work of taking care of our patients is hard enough. Absolutely. How do we make sure that we respect that work? And, that's the task, to figure that out. Now, how do we do that is a different issue, right? And I give you that backdrop just for a bit because fear is useful, but for me, I use it as a motivating factor, not to paralyze. And at the same time, I want to make sure that we think expansively, because ultimately that's what we need. And that's the approach that I think is so important for us to take. Think expansively, bring our key stakeholders to the table. Do this in partnership. Policymakers, politicians, hospital systems, other FQs and community health centers. How do we do this together? For me, it doesn't matter which door people go through, as long as they get the care they need. So are there better ways for us to leverage our shared resources to get our patients the care they need. That's the work, and I think that's the approach that we need to take. Yes, we need to make sure that people are aware of the problems. Yes, we need to make sure they understand the criticality of the care we provide this segment of the population. And at the same time, we continue to need to figure out ways to do it better. No challenges the way we're currently doing it, but there's always ways we can do it better. It does recognize the need that we probably have to change a little bit, maybe give up some of the how of we've done it before, but never the why. And at the same time, bring people together and solve this in ways that we can do it to really impact our patients and communities. So that's the approach for me. That's the way I think we need to go. And quite frankly, that's the work we're doing. We had some great partners at the gala on Saturday night. They understand. They know that we play complementary roles in taking care of our broader community. And together we'll take care of this. And so they're at the table with us, and we're so proud to be able to call them partners.
I love that. And I think that's 100% accurate. There's no way health centers can't do this alone. And we never have. It's always been about partners. It's always been about working together. And again, that sort of beautiful patchwork of what are all the needs in the community and who is in the best position to be able to respond and execute to meet those needs. I'm looking at time, and I think we have time for one more question. And you sort of got to this. So I'll give you the question then and then also say, is there any last sort of thoughts to share? But if we want community health centers to still exist in 50 years from now, what do you think we need to start doing differently today?
I have this philosophy, and it simply said, what got us here won't necessarily get us there. Let's not throw out those great things that got us here. Let's embrace that. At the same time, let's acknowledge reality. Let's look externally to figure out how we can solve for those opportunities tomorrow, next year, and beyond. And if anything, I think it's that type of expansive thinking is what's needed. By the way, not pie in the sky type thinking, to be clear. Practical, pragmatic, but forward-looking thinking. I keep coming back to practical. Each of us playing our role, working with policymakers, working with the hospital systems, working with private payers, working with our fellow community health centers. But to say, hey, we know this is going to continue to change. How can we make sure that we do the work to do it? So long story short, what does that look like? I think in many ways more of the same. Communities who depend on us for care. Patients who come through the door and know that they're going to get care regardless of their ability to pay or who they are or what their issue is. A trusted relationship between the provider and the patient. That's all going to stay the same. The vehicle for that's probably going to change. How we fund it, that's probably going to change. Do I have a crystal ball for those answers? Nope. But what I do, and I know everybody else does, has a willingness and commitment to do the work to solve those issues.
Well said, as usual. And it will be, as always, about evolution and innovation. But again, rooted in that mission and rooted in, as you said, who we are as a movement, who health centers have always been, which is for the community, of the community, and always about patients and their needs. John, I'm so grateful for the work that you're doing and for the conversation today. I'm so incredibly proud of what you've been able to do and the entire Lifelong team. 50 years is a very big deal in the health center world and in general. And I have no doubt that the next 50 years, you guys will continue to trailblaze and show us the way in terms of continued success. I expect this will be the first of many conversations on the podcast today, because I know you guys are continually innovating and looking at new ways, like you said, to evolve and respond to the needs of the community. And so we'll get you back on to talk about some of those innovations. John, thank you so much for being here and for sharing not just your leadership perspective, but your story. What stands out to me from this conversation is that community health centers aren't just built, they're carried forward through people, through purpose, and through a deep commitment to the communities they serve. And as Lifelong Medical Care celebrates 50 years, it's a powerful reminder that this work only endures when leaders are willing to both honor what came before and adapt to what comes next. For those listening, whether you're a provider, a policymaker, or someone thinking about your own path, this is the kind of work that lasts and the kind of leadership that matters. Thanks so much for joining us, and we'll see you next time.